Hello, welcome everyone. Today we'll be discussing the clinical anatomy of median nerve. Okay, so here you can see the median nerve. It originates from the brachial plexus as outlined here, and after originating from the brachial plexus it runs in the medial aspect of the arm, then crosses the elbow. It goes between the two heads of pronator teres muscle and then goes in the forearm, it between the superficial and deep flexors, and then it runs through the flexor retinaculum, also known as carpal tunnel, and supplies the intrinsic muscles of the hand. So that's the basic or gross course of the median nerve. So median nerve is a complex nerve. It supplies multiple muscles, and also it has cutaneous innervations, especially in the hand. So this picture actually shows mainly the muscles that are supplied by the median nerve. Basically, it supplies the flexors of the forearm, and other than flexors of the forearm, it also supplies the small muscles known as LOAF muscle, LOAF. This is an acronym or mnemonic for remembering the muscles or small intrinsic muscles of the hand supplied by the median nerve. The L stands for the lumbricals, the first and second lumbricals, also known as lateral lumbricals. Then opponens pollicis, abductor pollicis, both of the muscles inserting on the thumb, and also flexor pollicis brevis, also a muscle for thumb movement. So those are the muscles that are supplied by the median nerve. Then comes the cutaneous supply. It supplies the lateral part of the palmar surface of the hand. There are two nerves or two nerve branches of median nerve that supplies the skin of the forearm or skin of the palm. One is the palmar cutaneous branch, which supplies the thinner eminence and also the thumb, and another is digital cutaneous branch, which supplies the fingertips, and also not only in the palmar area or palmar surface, but also in the dorsal aspect. Okay, so whenever someone has a median nerve injury, they will have loss of sensation from those areas. So there are multiple causes of median nerve injury. The most common ones are listed here. So there can be a proximal lesion. Proximal lesion can occur due to the fracture of supracondylar humerus. This fracture commonly occurs in children, especially when they fall on the ground, and this puts pressure on the supracondylar bone or supracondylar humerus, and then the fragments displace from their place and compresses on the brachial artery and also median nerve, causing a proximal lesion of the median nerve. And actually the more common cause of median nerve injury is carpal tunnel syndrome. This is a chronic injury syndrome which can occur in people with diabetes, with acromegaly, with hypothyroidism, or other connective tissue disorders, leading to compression of the median nerve at the carpal tunnel. And it is actually precipitated by jobs like someone who is a typewriter, or someone who is an office assistant or a receptionist. Those kind of people are more likely to get this carpal tunnel syndrome. There are rare instances where there can be dislocated lunate bone. Lunate bone is a carpal bone on your wrist. In the front row, it lies in close proximity to the scaphoid bone. So whenever you fell on the ground with the outstretched hand, the lunate bone can be fractured, leading to a distal lesion of the median nerve. Okay, so those are the common modalities of median nerve injury. So here you can see a typical motor manifestation of the median nerve injury. This is called median claw hand. Median claw hand. You can see those fingers are flexed. If I become more medically accurate, then I can say that the distal interphalangeal joint and the proximal interphalangeal joints, those two joints are flexed in this patient, and the metacarpophalangeal joints are extended. So let me explain why this kind of claw hand occurs in the median nerve injury. As you can see, this only occurs with distal lesion of the median nerve. So median nerve comes through this area and then crosses the wrist under the carpal tunnel, and then it supplies the small muscles like the lateral lumbricals, or number 1 and number 2 lumbricals of the hand. So whenever you have a damage of the median nerve at the wrist, the forearm flexors are unaffected. Those flexors can work properly, but those lumbricals, as they are innervated after the crossing in the wrist, those lumbricals can't work. And the job of those lumbricals is to extend those fingers at the PIP, or proximal interphalangeal, and DIP, also known as distal interphalangeal joints. So as you have lost your lumbricals, you cannot extend those PIP and DIP joints. That's why they are in a flexion deformity. It is further augmented by the flexion action of the forearm flexors, like flexor digitorum profundus or flexor digitorum superficialis. They also exert this finding, resulting in a medial claw hand. So in summary, median claw hand in distal lesion. Another type of motor manifestation of median nerve injury can be a sign called hand of benediction. So this is a sign used by the Pope. So as you can see in this patient, his fifth and fourth fingers are easily flexed, but second and third fingers, or index and middle fingers, are not flexed. He is trying to flex them, but he is not able to do so. So it says that his proximal flexor muscles of the forearm, like flexor digitorum superficialis and profundus, are affected. So this occurs, this sign of benediction or hand of benediction occurs due to the proximal injury of the median nerve, especially at the supracondylar region. Because if you lost the median nerve in that region, the muscles of the forearm are no longer supplied. So they can no longer flex your second or third finger. So you will have an extension of this finger because the radial nerve is intact, the extensors are intact, so there will be extension, but there will not be any flexion. So this is the hand of benediction in median nerve injury. That's all from me. Thank you everyone. I hope we will meet you again when we discuss the ulnar nerve injury.